Good afternoon, everyone, and welcome to today's webinar, Confidentiality and Evidence-Based Programs. My name is Jim Bugg, Physician Practice Specialist with Health Quality Innovators, and I will be your facilitator today with the help of my colleague, Jennifer Hayes, HQI Program Manager, who will be assisting me in monitoring chat questions. We would like to make a general statement before we begin. This will be a high-level discussion, and we will review some of the most restrictive types of rules and laws regarding privacy and security. But depending on where you and your program falls under these rules, you may or may not be subject to some of them. But regardless, these are best practice rules that can be applied in many cases to the work you do in your programs to help secure and protect the confidentiality and privacy of the participants you work with. We also feel there is value for you as citizens and consumers of medical care to understand what the rules are as well. So our agenda today includes a quick introduction and review of the webinar logistics and review some background about HQI. Sue Vaith will review the Prevention and Health Promotion Administration mission and vision. Then we will dive into confidentiality and evidence-based programs and review the HIPAA privacy and security rule, as well as the HITECH Act as they pertain to participant confidentiality. For clarity on today's presentation, if a specific evidence-based program is considered a covered entity under HIPAA, they are required to follow the HIPAA guidelines by law. We will review the details about how to identify a covered entity on a later slide. But regardless of if you or your program are subject to these laws, the information we will review includes some best practice guidelines you can apply to the work you do to help secure and protect the confidentiality and privacy of the participants you work with. As we discussed, there's also value as citizens and consumers to understand what the rules are. At the end of this presentation, you should be able to better understand the basics of how to maintain confidentiality and security of PHI within the evidence-based programs. Also, how to mitigate and handle security breaches, how to strengthen workspace program security through process and procedure improvements, how to protect confidential information through a critical assessment of work practices for compliance, and we will also review best practice examples for putting them into practice at your program. We will also have some time at the end for questions and answers, but feel free to use the chat functionality to ask questions as they arise during the presentation. Also, at the end of the presentation, we'll have a kind of a survey for you to give us some more information and feedback about the webinar, so please be sure you answer that. So I want to remind everyone, just for some logistics for this webinar, the audio for today's session will play over your computer speakers. If you have questions or comments during the session, please type them in the group chat. To access the group chat, click on the dark blue square that has a chat icon. At the bottom of the screen, it's at the bottom of the screen. There will be time at the end for Q&A as well, like I mentioned, and you may review handouts and resources from today's session by clicking the green icon with a sheet of paper on it. Today's session is being recorded and will be emailed to you within 24 hours, and then there will be the short evaluation at the end. It will appear on your screen after we end the session. So Sue will be going over the mission and vision.
Hi, this is Sue Vaith. I'm the Diabetes Coordinator at the Center for Chronic Disease Prevention and Control, and we're very happy to provide this webinar for you today. This is just a statement of our mission and vision. And I just wanted to mention a couple of things. I wanted to take a moment to let you know some of the resources that we have available in our center to help you maintain your programs. Aside from this and other past and upcoming trainings, such as motivational interviewing, we have an advanced motivational interview providing compelling group sessions and a number of other marketing. We provide sister websites, the BeHealthyMaryland.org and the Workshop Wizard. The Workshop Wizard is a HIPAA-compliant site that helps you publicize classes, manage referrals and feedback to physicians, manage data, participant data, and assist billing for the diabetes program. We have not gotten to billing for other programs yet, but if there is a need, then we will certainly consider doing that. Our center also provides periodic funding opportunities for evidence-based program providers to expand their programs, or to other community-based organizations to develop new evidence-based programs, such as the National Prevention Program, Diabetes Self-Management Education. We have a diabetes prevention network that meets quarterly via webinar and in person, and we're planning for the same for diabetes management providers. This webinar is being recorded and will be available on our Be Healthy Maryland partner resource and in the help section of the workshop wizard for those who have access to the website. If you want information about any of these resources, you can contact me at sue.vaith@maryland.gov. And I also just want to mention a certificate of completion is also available after you complete the evaluation at the end. Thank you.
Great. Thank you, Sue. And again, just to remind everyone, if you have any questions or statements or information you want to share, please put it in the group chat. So just a brief word on who we are at HQI. HQI is a nonprofit health quality consulting company based in Richmond since 1984. We serve as the Quality Innovation Network and Improvement Organization for Maryland and the Commonwealth of Virginia as designated by CMS. Some of you may know us through our services as the Virginia Regional Extension Center, where we assist healthcare providers with implementing EHRs and meeting meaningful use and promoting interoperability requirements. We are a practice transformation network for CMS, and we provide program coaching and the ARC Evidence Now Collaborative in Virginia, where we optimize programs to improve heart health and restore joy to practice. So just a little disclaimer, the following PowerPoint presentation has been prepared to educate participants of recent events surrounding privacy and security under the HIPAA HITECH Act. This information is not intended to suggest or offer legal advice. So we're going to move into a quick polling question. I'd like to request that everyone kind of just answer the question to the best of their ability here. It's a true or false question. So I'll give you a few seconds to click what you think is true or not, and then we'll wait for you for a second. And then we'll submit that and see if we've got some results. Oh, I got 100%. Nice work. Okay. So I thought it was important that we covered what a HIPAA-covered entity is. So to better understand if you or your program meets the definition of a covered entity or business associate, we're going to review both. So as you can see on this slide, you are considered a HIPAA-covered entity if you fall into one of the following categories. So there's healthcare provider, health plan, and healthcare clearinghouses. So the first one is probably the most relevant for your group and includes doctors, clinics, psychologists, dentists, chiropractors, nursing home, pharmacies, but only if they transmit any information in an electronic form in connection with a transaction for which HHS has adopted a standard. The other categories include health insurance companies, HMOs, company health plans, or government programs that pay for health care, like Medicare and Medicaid. And then there's the clearinghouses for healthcare, which would be kind of like your billing clearinghouses. They process all the electronic information. I also have a link at the bottom of this slide that you can click on after you get the actual PowerPoint, or it's in the list of resources. I think you can pull it up. You click on that hyperlink and it should take you right to the HHS site that talks about this. You can get a lot more detail. And as you can see on this slide, a business associate is a person or entity that performs certain functions or activities that involve the use or disclosure of protected health information on behalf of or provide services to. So some examples are included, like your CPA firm, which accounting services They might have to look at protected health information, or an attorney providing legal services to a health plan. Anyone who's got access to that data or that participant information. Consultants that review, records about patients for a hospital or other healthcare organization. The clearinghouses, like we talked about, for billing. Maybe a medical transcriptionist that provides transcription services, and then pharmacy benefit managers managing a health plan and in a healthcare network. So then we'll just do a quick summary of what the HIPAA privacy rule is. HIPAA stands for the Health Insurance Portability and Accountability Act, but there are two parts to HIPAA. First is the privacy rule, and then there's the security rule. It is the privacy rule which establishes the national standards to protect individual medical records and other personal health information. And it applies to some of the stuff that we just talked about with health plans and clearinghouses and other healthcare providers. And then we've got a definition on here about privacy, which is the right of an individual to keep his or her individual health information from being disclosed. So think about that as you as a consumer, how important your privacy is when you're thinking about working with your participants' privacy. And then the second part of the HIPAA rules are the security rule. Sets the security standards for the protection of electronic protected health information, and it's a national set of standards for protecting certain health information held or transferred in an electronic form. So the definition is it's the mechanism in place to protect individual health information. And one of the examples I can think of is, everyone's kind of heard of encryption. So that's an example of one of these type of mechanisms that someone covered under HIPAA would have to keep electronic data secure. So then just the HITECH Act. HITECH stands for Health Information Technology for Economic and Clinical Health. This act kind of came later after HIPAA. It's the privacy and security associated with the electronic transmission of health information. That includes anything that's the health information that's produced, saved, transferred, or received in electronic form. So there's some pretty strict rules about encryption, and if data is stored on a hard drive, it's supposed to be encrypted. That's called data at rest. And then if you're transferring it electronically over the internet or email, things like that, it's supposed to be encrypted, and that's in motion. Data in motion has to be encrypted. So just think about, if you're sending emails to somebody that might have your participant information on it, you shouldn't be doing that. It should be encrypted. You might speak to your manager about any particular encryption service that your organization already uses. So we want to work on understanding the basics. So in many ways, HIPAA's pretty much, most people think about utilizing electronic health records, and that's basically it. But the information we're going to be reviewing is also applicable to any protected data that might be stored in any electronic format. So think about your copier, your scanner, because these typically store an image on a hard drive, or think about imaging or radiology tests that are sent and received electronically. So basically, if it's stored electronically in some way on a hard drive or in the cloud or transmitted, the information we'll be reviewing is pertinent. So let's move on to the next slide. PHI, that's protected health information, is considered to be individually identifiable information that's created, collected, maintained in electronic media or any other form or medium, or transmitted by a HIPAA-covered entity or by a business associate of a covered entity. So the information must relate to past, present, future physical or mental health, or condition of an individual, the provision of health care to the individual, or payment for the provision of health care to an individual. And then we've got personally identifiable information, or PII. This is any information about an individual maintained by an agency, including but not limited to their education, their financial transactions, their medical history, criminal or employment history, any information about the individual which can be used to distinguish or even trace down an individual's identity. So the best rule of thumb to remember is if the information identifies or provides a reasonable basis to believe it can be used to identify an individual, it is considered PII. So many of you on the call today don't use an electronic health record or use paper medical charts, but think about any software or spreadsheets that you might be using that might contain PII. So let's review some examples of everyday PII that you need to be aware of. I'm trying to see this slide a little bit better. Name, address, anything that's got a date on it, like a date of birth, telephone numbers, maybe their health plan beneficiary numbers, IP address from their computer, biometric identifiers, pictures, anything that's uniquely identifiable. And then even they added genetic information is included under that as well. So practices and programs have a responsibility to provide a notice of privacy practices, or NPP, to all participants at their first visit or upon request. So that includes, it basically informs them of how the covered entity may use and disclose the protected health information about them and the individual's rights with respect to the information and how the individual may exercise these rights. Also, how the individual can complain to the covered entity without having to worry about any sort of, blowback on them. The covered entity's legal duties with respect to the information, including a statement that the covered entity is required by law to maintain the privacy of protected health information. Who the individual can contact to get further information about the covered entity regarding their privacy policies. So again, I've put a link at the bottom that kind of can give you more information about NPPs, and even including how you can download a model NPP provided by HHS. So we're going to go over business associate agreements a little bit more. If a program is considered a covered entity, they must have a BAA in place with all business associates to ensure that participants' information will be kept private and secure. However, evidence-based programs don't use EHRs or charts, but do use software spreadsheets developed for tracking program-specific participants. So examples could include CDC Excel spreadsheets, online databases for tracking DPP participant data. There's also a HIPAA-protected website that you use, and Workshop Wizard for managing participant data and referrals for DPP provider and the participant doctor. So just think about all the people you may be working with. You might be the BAA, and I see in the chat at Gregory, you will likely have a BAA with a covered entity. So keeping that in mind, if you're working with somebody who maybe is a HIPAA covered entity, you've got to have that BAA in place, because then you are supposed to be securing that information that covered entity is working with you on. So now we're going to talk a little about a security breach. So generally speaking, a breach is an impermissible use or disclosure under the privacy rule that compromises the security or the privacy of PHI. The impermissible use or disclosure of unsecured PHI is presumed to be a breach unless the covered entity or the business associate demonstrates, you have to do a risk assessment of some sort, that there is a low probability that the PHI has been compromised. When a breach of unsecured PHI occurs, the rules require notifying the affected individuals. That includes the Secretary of HHS and in some cases the media, depending on how many people are breached. Here are some examples. So here's one that I've seen happen a lot in a lot of organizations, is misdirected fax that somebody typed in the wrong number and it went to the wrong place, but it's got PHI on it. So be sure to double check the fax number you typed in before sending any PHI. Also, it's best practice to get a confirmation report that it went to the right place, and in some cases even call the recipient to confirm they got it and secured it. So there's also lost or stolen mobile device devices or transmission of unsecured or unencrypted emails like we talked about before. So like an example that I was provided that might be pertinent to you guys, if someone's requesting help with the workshop wizard, and is there any information involved in that? So you want to make sure it doesn't have any PHI. Talking about participants in an unsecured area like an elevator or other public spaces, use of coworkers' accounts, sharing of passwords, leaving a workstation unlocked and unattended. You don't want any unauthorized people seeing the data on your screen either. So best practice would be to use the computer's Control-Alt-Delete to lock your computer if you leave your workstation. And this is one of those things that's really good just to get in the habit every time you do it. And that way you can mitigate any chance that you've got a breach with somebody just walking by and seeing something that you don't want them to see. Or even using the system in an authorized manner. What is the access must be specific to your required job duties. Also think about unsecured paperwork with participant information left out in public view, or participant reports you may have on paper, and be sure to secure them when you're not working on them. And if available, always use a shredder to dispose of them when done. Your organization may have a service that helps with that. So that's always good best practice. So who's got to be notified in case of a breach? Well, most importantly, it's the participant. And also, with the breach notification rule requires HIPAA-covered entities to notify the media if the breach affects more than 500 residents of a state or jurisdiction. So here's just an example of a breach notification I saw a while back. And you can find these types of things online all the time. So this was a breach of Oregon DHS with a phishing attack. So basically, the phishing is somebody is, sending bogus emails, phishing emails to people who work at Oregon DHS, and they responded and got more information about how to log in and hack that system. So you've got to be real careful about emails you're getting and what you're clicking on, and if it looks legit or not. So I would talk to your supervisor, managers, or any IT folks about any protocols you all have in place for process and procedures about emails. So regardless of the number of participants that are involved, covered entities must notify the Department of Health and Human Services of the loss, theft, or certain other impermissible uses of disclosed or unsecured PHI. Reporting requirements differ based on the number of individuals affected by the breach. If there is any breach of unsecured PHI that affects 500 or more individuals, healthcare providers have to promptly notify the Secretary of HHS. And promptly is defined as without unreasonable delay and in no case later than 60 calendar days from the time you discovered the breach. If a breach affects fewer than 500 individuals, reports of these breaches are due to the Secretary within 60 days of the end of the calendar year in which the breach was discovered. So what's in a breach notification? So it includes what happened, date of the breach, the date of the discovery, what types of unsecured PHI were involved, what the program is doing to investigate the breach or mitigate the losses and protect against further breaches, contact procedures for individuals to ask questions or get more information, which shall include a toll-free number, email address, website, or postal address. Breach notifications are completed through the Office of Civil Rights, and they have a web portal to complete these. So near the end of this presentation is a resource page, and the link to that site is on there. So if you want to take a look at it, it's available. So is your program ready to avoid a security breach? HIPAA still, even if you don't have an EHR, HIPAA still covers the data that you might have stored on paper, on a computer or mobile device in emails, Word documents, spreadsheets, PDF, practice management systems, or other types of files that include patient information. Let's review some best practice questions that can help you determine how best to assess your risk and work to mitigate and avoid a security breach. So if this is applicable to you, do you keep participant information and data locked, monitored, or have other sort of physical safeguards in place? Are all staff trained to secure all PHI when it's not in use? Does your program maintain an inventory of all the programs or the computers and laptops or any of the installed software or other mobile devices? Has your program determined who uses them and their security access privileges? Or have you determined the policies for which data is allowed on them and what data is actually, does your program have a data backup policy? Has your program ensured data is protected against unauthorized access? So there's probably a lot of, you might have some process and procedures about how to avoid malware, downloading viruses, and safeguards for all workstations that access PHI and restrict access to only people who are authorized to use them. So just these are some good best practice examples to help mitigate potential security gaps. So depending on the program you work in, this may or may not be relevant. But if you're in an office environment or other physical, it's important to have other physical safeguards in place to help your program mitigate and avoid potential security breaches. For example, program areas that are open to the public or participants should have some, there should be someone physically present in the case of a security issue. Having somebody being able to oversee what's going on in that office. Making sure office entry doors are closed and locked at all times, unless it's being physically monitored. And also, like, office keys and alarm passcodes should be specific to the needs of the team member, and those should be locked up as well. Other best practices to mitigate or avoid a security breach could include, including like visitors. Do contractors or repair staff, that come into your, office area or building, wherever you're working, do they sign in and show a picture ID before being allowed further onto the premises? Or are they being escorted if they have to get into like your program area? It's important that they, wear a visitor's badge and never let in visitors and leave them unaccompanied. So privacy and security best practices will help to ensure your PHI and PII are not compromised. So, this is a tough one for a lot of people because, it's hard to keep track of all the passwords people have to have, but having strong passwords are not easily guessed, so that can help mitigate somebody being able to hack into your system and figure out what your password is. So don't write them down on a sticky. I've seen it in a lot of practices or offices where someone has written down their password on a sticky note, put it on their monitor, like the picture in this slide looks like. Passwords should be at least 8 characters, and they should include a combination of upper and lowercase letters, and at least one number and one special character at least. There are even software products that are out there that can help provide randomly generated hash-strong passwords for you. So make sure your IT department or your programs are configuring systems for regular change so that, say that it requires that the workstation forces you to reset the password at least every 90 days. So if your program has an IT department or even an IT service vendor, they may be managing all of this for you, but it is good to understand how they're monitoring and managing this for your computer assets. You can also use the same best practices with your personal devices. Be sure that your computer system has the most up-to-date antivirus, anti-malware software, and that is updated regularly because this is constantly changing. Ensuring your operating system and third-party antivirus programs are updated and maintain the most current versions will help your computers and information systems avoid some of the following symptoms of an infected computer, like it won't start normally, the system repeatedly crashes for no reason, internet browser goes to unwanted websites or pages, and also antivirus software appears not to be working. Sometimes it'll just be off for some reason. You didn't actually turn it off. And you might get a lot of unwanted ads or pop-ups, or the user can't control the mouse, or it just doesn't work the way you're expecting it to. So those are all things to kind of keep aware of that you might actually have a virus. And so above and beyond any of the antivirus software, the first line of defense for information security would be to have a good firewall in place to help prevent viruses or other malicious code from infecting your network or computer. This is something also probably managed at a program level through your IT department or vendor, but using a firewall helps keep the viruses out. That's the whole purpose. So this helps mitigate you getting a virus or malware in the first place. So check with your IT or your security officers if you're not sure. So if you're not sure, determine who your organization identifies as being responsible. I'm sorry, I got distracted. Identify who's identified for administering appropriate access control to your PHI. Usernames and passwords are part of your access control system in which users are assigned rights to access. So an administrator will assign those roles to employees, then uses those roles to grant access to PHI only to people with a need to know. Role-based access control further limits what information may be accessed. Should be associated and aligned with roles and responsibilities as part of their job description and defined responsibilities. Program policies, procedures, and processes and training should ensure all staff know and understand how to secure their devices that may contain PHI. Common devices that contain PHI include, but aren't limited to, portable storage media like USB thumb drives, laptops, smartphones, tablets, desktop computers, hard drives, backup tapes, network servers, copiers, and scanners. Wherever it's feasible, utilize encryption for any PHI that's stored electronically. Also, be sure you secure your network and limit the access to who can get onto it. Use networking tools with extreme caution. Wireless routers need to be secured. Do not give access to devices brought into the program by visitors. Again, this is typically managed through an IT department or vendor, but they should be ensuring your network hardware and devices are physically protected and locked away from visitors. For example, if your network hardware, routers, and modems are in a closet in the hallway where visitors walk, be sure it's locked and protected at all times. So evidence-based practice staff don't have much, if any, control over this area, but it's important to know that your governing organization or IT department should be working to avoid potential unexpected system downtime and/or delays providing timely access to participants. Staff should be aware of what to do in case of unexpected downtime or emergency situations. It is recommended that the organizations and staff are prepared as much as reasonably possible when the unexpected does occur. One of the best ways to do this is by backing up data regularly and reliably. Data has to be captured correctly and quickly and accurately restored. And a lot of people I've seen where they're like, yeah, my IT department, they back everything up and they can restore it, but I've seen it where they don't test that. So you end up going, it took us 2 days to restore it, and they just hadn't tested it before. So make sure you test that in advance to ensure it works like you expected. Be sure you have a sound recovery plan so all parties know what to expect in the event that this occurs. Have clear procedures in place, and when they are well communicated to staff, be able to access backups and restore functionality. So store backup in a remote location if it's possible. For example, if your building burned down and all the computers in that building were destroyed, how would you access your participant data? So if you took that backup data and stored it somewhere else that was safe and separate from that building, you'd be able to restore it. So I was just thinking about your DAPS program and how that is maintained and backed up. So I'm sure there's a vendor who actually manages all that. How would you be affected if it was unavailable for a significant amount of time, or it was hacked or affected by some sort of ransomware? It'd probably impact your work in some capacity. So you want to be sure you maintain and reinforce good computer habits for your staff. Your IT department or system admin may be doing some of these already, but you may want to double check if you're not sure. You don't want to have any non-essential software installed, and you don't want to accept default configurations when installing software. You want to check the back door, which refers to any access to a computer system or encrypted data that bypasses the normal security mechanisms. There's worms or viruses that can gain access to your system. You want to make sure you disable remote file sharing and printing. You want to keep software up to date, like we discussed before. You also want to make sure you're disabling user accounts for former employees. When someone leaves, be sure you have an existing staff checklist that includes deactivation, an exiting staff checklist, that includes deactivation from your organizational network or computer systems or programs. You also want to make sure you're sanitizing the media before you dispose of it. And there are some third-party vendors out there that can do that and provide a certificate of destruction if you don't have a way to do this currently. So you want to make sure you're also uninstalling old software, because that could still have some backdoor ways of somebody getting into your system. So it's also important to protect mobile devices. Everyone's got a smartphone now, so you want to protect any mobile devices that could transmit or store PHI. They're much easier to lose and more vulnerable to theft. They're also more likely to be exposed to electronic or electromagnetic interference, which could disrupt or destroy the data. You want to take extra care to prevent unauthorized viewing in public places. If you're using your mobile device in a public area, use privacy screens if it's needed. Use strong authentication and access controls like two-factor authentication or a reputable authentication app. Do not transport data with mobile devices. Ensure you have policies in place to ensure data is not stored on the device itself, and encrypt your data. So we're coming to a point in the presentation where we got some more polling questions. So please, someone make sure everyone's doing as much as they can to answer all these. So the question is, it's okay to take pictures using your personal smartphone of your work environment that shows participants or their participants' personal identifying information. So just think about situations where you might have a camera out, you want to take a picture of something cool where you're working, but there's information laying around. So this is true or false. So let's see what sort of answers we're going to get. I'll give you a few moments to answer those. Okay, so I'll give you just a few more seconds to answer that. Okay, let's see if we can find the results. False, 100%, very good. That's great. Yeah, it is not okay to take pictures using your personal smartphone of your work environment, especially because inadvertently you could show participants or some identifying information. So the other poll question we have, it's true or false. It's okay to gossip about participant personal information as long as you don't mention them by name. So this is true or false as well. So please take a moment to answer this. Okay, hopefully everyone had some time to answer that one. Okay, so we've got 83% said false, and 16.7 said it was true, but the answer is false. You don't gossip about anyone. Think about if you're in an elevator or something like that. You don't want to be talking to somebody when someone else is around, because who knows who they might be, and you don't want to have that information. So make sure if you're talking about a participant, that you're doing it in private in a secure location. Okay, we've got another polling question. This one is multiple choice. So just consider the fact that you're replacing 3 computers. What should happen to the old one? People get rid of computers all the time, but think about that hard drive. What do you think should happen to the old one? So the options are: take them to your local computer recycling center, or just install a new operating system and then sell that old computer to employees for personal use. Or the third option is remove the hard drives and either destroy or wipe them to permanently remove all data prior to disposal, including, don't forget about fax machines and scanners. Many of them have hard drives too. Just a few moments for people to answer. Okay, hopefully everyone's had some time to answer that one. We'll see what the answers are. Okay, correct. 100% remove the hard drives and either destroy or wipe them to permanently remove all data prior to disposal. So, in a lot of situations, organizations might rent a fax machine or a scanner or even a computer. So you got to make sure in your contract with those folks, are they going to have something that wipes or destroys all that? If you own them yourselves, for the organization, if they own it, you can hire third-party groups to actually destroy them for you, and then they'd give you a certificate showing that they destroyed them to the standards that are required. Okay, so good job on that one. Got one last polling question. This is true or false. When you are actively working on a spreadsheet with participant information and you have to step away from the computer for a few minutes, it is best practice to lock the computer so no one can improperly access the participant information or the computer while you're away. Is this true or false? So take a minute to take a look at that and answer to the best of your ability. Okay, just a few more seconds. All right, let's take a look at what the answers are. 90% said true. That is the correct answer, that it is best practice to lock the computer so no one can improperly access the participant information. So good job. And so that's the quick, easy way with, like if you're using a Windows computer, is if you hit the Control, the Alt, and the Delete button all at the same time, it locks the computer. And just like I said earlier in the presentation, is just make that your habit, that you start doing that anytime you step away. Some computers will also have a timeout, but sometimes they're like 10, 15 minutes or something like that. So you want to make sure you're hitting that Control, Alt, Delete to lock it. Okay. So let's talk some more about some security culture as a best practice. It's extremely important that organizations establish a strong security-oriented culture to ensure good privacy and security. Protect your participants at your organization because you want to maintain that reputation that your organization has in the community, because it can happen to you. At the time of this webinar was put together in late June, there were, and I've got some links down here for breach reports in the slide. They call this the Wall of Shame for the Office of Civil Rights. There were 8 reported breaches of 500 or more participants in Maryland alone. 5 were hacking and IT incidents, 3 were unauthorized access and disclosure, and all but 1 were in 2019. So we're only through the middle of the year here. So, and 1 was from 2018. So these breaches affected a total of 116,000 individuals. So it can happen. It does happen. And so you want to make sure you're protecting yourself and your organization. So to help build your culture of security, hold frequent and ongoing education and training. Ensure that leaders and managers are setting good examples and following the organizational policies and procedures. If the managers and leadership don't do it, the staff they manage may not do it as well. So accountability and taking responsibility for information safety must be a part of the organization core values. And I've seen that in organizations where, staff see their supervisor isn't doing it, so they don't think they have to do it either. So that's a key one. Actually, I think I may have placed, oh, I know. I didn't take these out. So you're going to have to pardon me on this one. I think I forgot to take these out. I think this one, it's not a polling, but it's really who is your program privacy and security officer, and just think about that. I don't know enough about your organization, but is there somebody at your organization that a staff person can go to when they either think there's a problem with security or privacy, think there might have been a breach? Who do you relay that information to? So Sue, I don't know if that's something that everyone should know and who those people might be. So I've just want to make sure people ask their supervisor or manager who they need to talk to in the case of that, something being going on with privacy and security. So it's important to have that designated security officer to help answer questions or relaying any organizational policies and procedures to how to mitigate and handle potential security breach issues. Also, HIPAA is the law for those covered entities. So, I wanted just to recap on this one with HIPAA. It covers both the privacy rule and security rule. There's Health Information Technology for Economic and Clinical Health Act of 2009 to address privacy and security associated with electronic transmission of health information. And in 2013, there was the HIPAA Omnibus Rule, which in part expanded requirements to business associates as well as liability. It also identified genetic information as PHI and addressed access to PHI in electronic forms and many others. So there's also some penalties for disclosure of confidential information, and they're escalating in nature. So depending on the willfulness of the covered entity, you can see each violation goes up in severity. So we've got here, if you didn't know, it's $100 up to $50,000 for each violation, and up to $1.5 million for identical violations in the same calendar year. There's reasonable cause, $1,000 up to $50,000 for each violation, and up to $1.5 million for identical violations in the calendar year. Then there's willful neglect. If you corrected it, $10,000 up to $50,000 for each violation, and up to $1.5 million for identical violations in the calendar year. Then there's willful neglect, and you didn't correct it. $50,000 for each violation, and up to $1.5 million for identical violations in the same calendar year. So, key takeaway is the better you are about identifying and reporting potential breaches, the better off you and your organization are going to be. So this is really just important information to know to help protect you and your organization and the participants you work with. So that concludes the main part of the presentation. This is Jennifer's information, contact information for Jennifer Hayes and myself. So if you ever need to get a hold of us or you have any specific questions, we're available. I also mentioned there's a resource page. You should be able to get to these once you get the recording and on the slides. And it's also in the resources button. I think you can pick up the slides that way as well. And you should be able to click the hyperlinks that are listed here. So we've got the NPP site, business associate agreement details, covered entity and business associate information, privacy and security guide, which is in Chapter 7, they talk about breach notification more specifically. And then breach cases under investigation, notification rule, how to report your breach on the OCR site, and then the example of the news information. Then there's also the National Institutes of Standards and Technology guidelines for media sanitation, and also the PII guide for protecting confidentiality. So those are kind of important information if you want to learn more. Also, you can hit us up on Twitter, Facebook, or even on our website if you want to keep up to date with some of the other stuff we're working on. And then we also have some time for Q&A if anyone has anything that they haven't put in the chat. And Sue, I don't know if you had any additional information you wanted to add.
I do. Let's just make sure just want to close things out, but I want to make sure there are no additional questions.
Great. So please, if anyone has any questions or need some clarification on any of the information we covered today, please put it in the group chat. Or if you think of something later and you want to ask a question, you can certainly do that, or contact Sue and she can contact us.
All right, well, I'd like to thank Jim Bugg and Jennifer Hayes for the comprehensive information provided in this webinar. I think this is a really important topic of information, or topic for people to really understand. So I want to thank you for attending as well, everyone who webinar. A quick reminder to complete the evaluation at the close of the webinar. Once you complete the evaluation, you'll get a certificate of completion. Certainly, we want your feedback, whether you want a certificate of evaluation of completion or not. We'd really like to have your feedback about what you thought about this webinar. The slides and a recording of the webinar will be available on the Program Resources.gov page in a couple. And we'll also be sending out this information to everybody, not only you, but to all of the evidence that you have access to this. And please, if you found it useful, share it around. Thank you so much.
Well, thank you, everyone. If there's no more questions for the chat, I see a couple people chimed in with some information, so I think those were answered. I'll give you maybe another minute if you want to put something in there. Otherwise, we'll end it in just a minute. Okay. Great. Thank you, Jennifer. 24 to 48 hours, slides and recording of the webinar will be available. All right, everyone. Thank you so much for attending. We really appreciate your time and attention to this. And I think we're going to go ahead and end the webinar at this point. All right. Well, thank you very much. Thank you, Sue.
Thank you. Bye.
Absolutely.